Hello, hi, welcome to my channel. I am Dr. Erica Onigbola, pharmacist for close to 10 years, and I'm coming back with you with another live video. I'm going to talk about pain relievers on today, particularly 5 that I have in stock, and I want to share with you some history behind pain relieving uh, prescribing and dispensing. So just to give some history, I have been a pharmacist for close to 10 years, and pain relievers are very, there's a lot of tape, illegal issues around pain reliever being prescribed and dispensed. So most prescribed pain relievers are for mild, moderate, and severe pain. Severe pain, like acute pain post surgery. So a lot of those pain medications are very strict and patients are evaluated before they can even receive a prescription for that pain reliever. And so they really must qualify to receive that. And so just to let you know, pain relievers are very, very well controlled, and the pain medications that I'm going to go over today are for mild and moderate pain relief, and they are over the counter as well. No prescriptions are required for the ones I'm going to show you, so do be informed about that. And I do sell pain relievers on my website, themillenniumpharmacy.com, for mild to moderate pain relief, generally for mild relief. And I also can order or have those products shipped to you. If you require a particular brand or particular product, please let me know. And also, I'll be happy to get back with you. Like, share, and subscribe to this channel. Just click on the little red button there, and also leave any comments that you may have. So I'm going to get started. And please visit my other videos as well about other classes of medications. I just did a video about 5 of the top medications for cough and cold, season, congestion relief, those type medications. So do visit that video as well. And also, one important video I want to mention is the top 10 of my recommendations for taking medications the healthy way, developing good behavioral habits when taking medications, and being consistent with medications. So do visit that video as well. Okay. I have several playlists out there that I would love to share. So let me know what you think. So today I'm going to get started. I have Bayer aspirin, which is an NSAID, a non-steroidal anti-inflammatory drug. So most of these pain relievers are anti-inflammatory, meaning that they will help reduce the inflammation that's caused by the immune system as a response to allergens, to cuts and burns. So once that immune system is activated, the inflammation and redness will occur. And so these pain relievers, they're not only pain relievers, but they're also anti-inflammatory medications too. So do be aware of that. So I have 325 milligram of Bayer aspirin, okay? And I'll show you. Bayer aspirin is directed for adults and children over the age of 12. Take 1 to 2 tablets by mouth every 4 hours, or 3 tablets every 6 hours, not to exceed 12 in a day. Also, the for breastfeeding and for pregnancy, do contact your prescriber first to get approval to take over-the-counter medications. Any particular medication over the counter, you should already have an approval from your prescriber or from your healthcare provider. Now this one is indicated for headache, toothache, muscle pain, pretty much any type of pain that you could think of that suits for mild or moderate cases. Anything stronger that you may need, I would not suggest this particular product, but it's a coated tablet, and it's 50 in this particular container. And again, it's for pain and also for inflammation and redness reduction. And again, so I do recommend that. It's one that I would try personally. I don't take a lot of medications, but I do. In said class, I'm going to cover the Advil and the aspirin, safety coded 81 milligrams. So this is aspirin. See it? Okay, so this is aspirin, 81 milligram, 100 enteric coated tablets. It's safety coated so that the GI tract does not feel irritated or cause cancer or ulcer erosion. So that's why most pain relievers, especially NSAIDs, non-steroidal anti-inflammatory drugs, will be enteric-coated so that that coat will protect this lining of the stomach. Once the lining of the stomach begins to deteriorate, holes begin to form in the GI tract, then surgery will be needed. Other medications will be added to help prevent and treat such. Okay, so this is for pain relief and for I would say for mild cases, and it is indicated to take three. Excuse me. You're gonna take the same. Take 4 to 8 tablets every 4 hours, not to exceed 48 in a day, and it has to be for adults or those who are greater than 12 years of age. And if you're pregnant or breastfeeding, don't take it just yet. Ask your doctor first because these medications can cause birth defects in certain cases of pregnancy. So do be aware of that. Advil is a brand name that's been on the market since I was very young. So I do remember Advil pain relief. This is 200 milligram. Ibuprofen is the generic ibuprofen, and it is coated caplets. So these are coated caplets. And the ibuprofen is also a non-steroidal anti-inflammatory drug, just like the aspirin. Okay, so it does a wonder on that track over time with long-term use. So do be aware of that. Okay, and this is 200 milligrams for small cases, like very mild cases, at home use. And directions are take one caplet every 4 to 6 hours while symptoms persist. For pain, fever, for headache, menstrual cramps, muscular aches, minor pain of arthritis, common colds as well, headache, temporary relieves fever. So if you have any of those, I would choose any of the three that I've gone over so far. Ibuprofen is a particular NSAID that lasts for about I want to say 6 to 8 hours. So once you take a dose, uh, two cap two caplets up to 4 caplets. Once you take a dose, it'll last for about 6 to 8 hours. Okay, and also the aspirin as well. They'll last about the same amount of time. There are some stronger or longer acting NSAIDs that are on the market, such as the Aleve and the naproxen. Those are over the counter as well. I have the fourth medication that I want to go over is Excedrin. Excedrin migraine has Tylenol, aspirin, and caffeine. The caffeine portion helps the absorption of the aspirin through the GI tract. That's what caffeine is for. All it does is going to help that aspirin get absorbed into the bloodstream. And this is 100 caplets, and this is Excedrin. Excedrin for you see that? Now this one is primarily indicated for migraine use. But it can be used for other pain symptoms, and um, it is. Is it? No, it's not enteric coated. This particular one is not enteric coated. Okay, I would still use it if I needed it for a first aid item. It has Tylenol 250 milligram, aspirin 250 milligram, and caffeine 65. milligram for migraine use only is what it says. Only for migraine use. So those migraine patients out there who continually have migraine and continually experience those type of um, uh, pre-migraine symptoms, do consider the Excedrin. And it comes in a temper-resistant bottle. I would definitely recommend it. Do not take more than 2 caplets in one day. And it's only for those who are adults. Only for adults. And then the next particular, I have some ointments and cream, pain relievers. I have Dawn's pain reliever cream for like arthritis, uh, on joints, mainly numbs away pain, non-greasy, fast acting. I would definitely recommend it. It's Maximum Street, and the active ingredient is going to be lidocaine. Lidocaine is good because it acts locally. It's not ingested. It's just a cream where it's going to act on the muscle area, on the joint area to help relieve that pain. And the other active ingredient is going to be menthol. Menthol is in there as well. I would definitely suggest it for adults. It says to apply a thin layer to affected areas 6 to 8 hours. Every 6 to 8 hours, okay? Do not exceed 3 applications in a day. So yes, I would definitely recommend it. And this is Dawn's, Doans. Dawn's. Okay. Dawn's. Lidocaine. Okay. Now I haven't tried it personally, but it says it is non-greasy. Non-greasy. Relatively speaking, I'm sure. And they usually come with discounted prices, and there is a coupon in this box. So for the next available purchase, so do be aware of that. And it is over the counter, no prescription required. Topical analgesic. Now, those are the 5 that I wanted to go over. There's one more bonus over the counter cream that I wanted to talk about. Pain relieving cream, Osteobiflex. Osteobiflex is menthol and methyl salicylate, and it works temporarily to relieve minor aches and pains of muscles and joints, such as the arthritis, strains, bruises, and sprains. Also, it can be used for up to 3 or 4 times a day for those who are over the age of 12 and those who are adults. Okay. Wash hands before and after use with soap and water. And it says it's instantly relieves pain, absorbs quickly, and it's non-greasy. Okay. And this is the product here. I'll show you. And it's I would definitely give it a try. And this is a good brand as well. It's a very good brand, so I would definitely recommend it for external use only. For mild cases, I would say, not even moderate, but just for mild at-home use. For like if you've been working out in the yard, or if you've been exercising and need some extra relief, I would definitely try it. Okay, for joint, particularly for joint health. Compared to the Dawn's pain relieving cream, it's more for backache pain. Backache pain. And it has menthol, and it helps with the nerves in the back. So the Osteobiflex is for joint health. And then the Dawn's pain relieving cream with lidocaine is going to be for spinal cord health and nerve ending relief, pain relief. So that's the difference between the Dawn's and the Osteobiflex. So do make note of that. Okay, so that concludes my presentation on the 5 big brand pain relievers plus the bonus. And so that gives you some choices to think about if you're just trying to decide on what OTC product to choose from, what would work best. I would say start off with thinking about, is the pain internal, or like stomach pain or menstrual cramp, or a migraine, I would say, or is the pain external on a sprain or joint, or strain, something like that. Then decide whether you're going to use the tablet or the enteric coated caplets, or do you need a topical. That helps to narrow down a lot and weed out a lot of the choices that you see on the shelves. So don't feel overwhelmed. Um, just narrow it down: external or internal, cream or caplet. Is it mild? Is it moderate or severe? What age is it indicated for? Is it particularly indicated for spinal cord pain, or is it nerve pain? Or maybe it's just a migraine, or it could be just something, that's not very serious, that you can just purchase over the counter. If it's more serious, then definitely be examined for something that is stronger and prescribed. Okay, so do be knowledgeable and be aware of that. I would suggest. I have enjoyed being a pharmacist, and I enjoy also going over medications with patients and choosing for them over the counter products. And also, this platform also helps me to get the word out about what's out there, how to narrow down medications, how to narrow down choosing a medication that's best for the situation, or the pain relief symptom, and how to go from there. So I do have that experience, and I've always enjoyed it. So ask your pharmacist. Don't hesitate. That's what we're here for. Like, share, and subscribe. And if you have any other comments, please let me know. I'm going to sign off. Thank you for joining me. I hope you've enjoyed the video. Bye bye.